Kelo-Cote dries quickly to form a flexible, waterproof and breathable film on the skin. When Kelo-Cote gel is applied to a scarf, the gel forms a protective barrier at the site of application, which helps to reduce chemicals, physical and bacterial effects, while maintaining the skin's moisture balance. This creates conditions for the normalization of collagen synthesis processes and does not allow the scar to grow, and also improves the appearance of the scar itself. Kelo-Cote can be used with pressure bandages or other aids. Indications: Kelo-Cote gel is designed to prevent, reduce the appearance, and improve the aesthetic appearance of both old and fresh scars, including hypertrophic and keloid resulting from surgery, trauma, wounds, and burns. Kelo-Cote is suitable for children and people with sensitive skin. How to use: make sure the skin on the affected area is clean and dry. Apply Kelo-Cote to the affected area in a condition thin layer and let it dry. Apply Kelo-Cote twice a day. For maximum effect, Kelo-Cote must be in contact with the skin 24 hours a day. After the gel has completely dried, you can apply sunscreen and cosmetics, as well as use pressure bandages. If Kelo-Cote does not dry within 4 to 5 minutes, the gel may have been applied in a thick layer. In this case, carefully remove the excess and allow the remaining gel to dry. The recommended duration of application of the gel is at least 60 to 90 days. For large gentle scars, a longer course of application may be required. Future use of the gel is recommended if improvement in the appearance of the scar continues after the first 90 days of use. The complete drying time of Kelo-Cote gel depends on the temperature difference between the gel and the skin. To reduce drying time in hot climates, store Kelo-Cote in the refrigerator. To shorten the drying time of the gel in cold weather, you can use a hair dryer. Medium temperature. Special instructions: avoid contact with eyes, mucous membranes, and open wounds. Don't use Kelo-Cote for dermatological diseases that violate the integrity of the skin. If Kelo-Cote is not completely dry, strands may remain on clothing. For external use only. If skin irritations occur, stop using the gel and consult a doctor.